Hey, thanks for joining us. Tell us about your experience in Washington State with 988.
Well, it's been an exciting year. I'm really proud of the work our state's doing. It's been an incredible team effort. And we were pretty early on kind of jumping into 988, and it was really helpful, all the work with SAMHSA and the draft legislation. And so we passed our first bill a couple years ago, and I think we're one of 5 states that include the fee. And that fee brought in about $50 million a year, and we were able to use that funding to double and sometimes triple the staffing in our 3 call centers. And what we found is it's been extraordinary. I mean, we had a 50% increase of calls, and our response time went from 50% to 95%. So it's been pretty dramatic. We also were able to start up a 988 tribal line called Native and Strong. It's the first in the country, and it's a beautiful partnership with the tribes in one of our call centers. And so that got up and running as well. We also have a next day appointments, and I really bring that out because it's really important. We know most of the calls are resolved on the phone, but for those that don't, it's really important that they get care right away. And this is a requirement not only on the Medicaid side, but our private insurance. So a lot of people have insurance and they have trouble accessing care. And so again, if you're suicidal and you're able to kind of stay in your home, you need to be seen by someone right away. And so it doesn't necessarily have to be your primary care provider, but it needs to be someone trained in mental health. So I'm really proud of those components. And this year, we had some next steps, which were really brought by the community. We were told, if you're going to have an alternative to the police, you need to be able to have a rapid clinical response. And so a lot of what we worked on this session is really to be able to get teams out there more rapidly and that they're non-law enforcement whenever possible. So I'm really proud. I think we have some good steps. We're learning along the way like everybody else.
Can you tell us of any kind of success stories that have changed lives because of 988?
The stories really touch my heart. And there is a gentleman, Danny, who's in the neighboring community, and he shared his story. He had been texting with one of our call centers, and he had been overwhelmed. He had lost his mom. He had this huge life change. And it was really escalating for him thinking about suicide. And so he, over several days, he was in the chat room with 988. And one day he took his car and he was on a railroad track. And he thought about all the messages the staff had sent him that gave him hope. And he saw the train coming and he started his car and he took it off the track. And he was able to get help. And so he shared his story, and this is why we do this work, right, is to save lives.
What do you think policymakers need to do from here, whether state level, federal?
Well, I think it's really important, and again, I want to really recognize all the federal partners and NAMI, and I think our federal partners have given us a path forward, and this is a once-in-a-lifetime opportunity. I'm a mental health professional. I worked 20 years in mental health, and I have never seen this opportunity. But we need each state to really come up with their plan. It's really important that they involve in the planning and implementation people with lived experience. Because our systems have failed so many people. We often traumatize people in crisis. People are sent to jail. They're sent to emergency departments and strapped in gurneys. And I know it's going to take time and trust, but I think they know what the path is. How do we create a system that's trauma-informed, that's healing, that's culturally sensitive? And that's going to take all of us coming together to figure that out. And so I think at the state level, we can give the resources and kind of design the system from the big level.
What about underserved populations? You mentioned tribes, and we've done a fair amount of reporting on tribes who, in many ways, are kind of forgotten, and they have major problems, with mental illness. Can you talk about that a little bit?
No, it's really important, and we had really good testimony when we had our 988 bill, and Vicki Lowe, who's one of our leaders in Washington State, she serves on the Indian Health Commission. She had shared her story and loss. And so I was really proud when we started looking at investments. The first investment with the fee was the tribal line. And they do have the highest rate of suicide. And so it's really important at the state level, we plan and invest in diversity and strategies up front. And again, Even when we did our rapid response clinical, 30% of the funds will go to the tribes. And so again, I think that's really important that we think about those things up front when we're designing a system.
What do you think about the stigma? Because years ago, I'm not saying this doesn't exist now, but there was this mentality from people who didn't understand, friends or family members, kind of get over it. What's wrong with you? To some extent, I do think, as I said with my interview with Javier Becerra, was, hey, people do recognize it more.
Yes.
Can you talk about that a little bit? And at least that's been some progress where I think more people, including some of my family members, are able to talk about it.
I think that's such an important point. And, I was touched by mental health as a kid. My father, who was my foundation, hardest working man I ever knew, he was a World War II veteran, and there's two things he never talked about. He never talked about his experience in the war, and he never talked about his father. And years later, I learned his father had taken his life by suicide, my grandfather. And so sometimes we learn early on that we don't talk about these things. They're painful, there's trauma there, but it's healing. And I think one thing with COVID is you say, how are you? And people say, fine. No one says fine anymore. They're like, I'm stressed, I'm overwhelmed. It's hard, life is hard.
Right, that's true.
So I think we're in a new time. And one of the things, I meet with a lot of youth, and this is really important to me, and they have been hit so hard by COVID. And the messages that youth have given me is, one, can you help adults be comfortable talking about suicide? They also tell me, can we have more mental health in the schools? And I do think as we're designing 988, we need to figure out those connections to our schools. If you had a magic wand, what's the biggest obstacle that you would attack to help people and save more lives? Wow, I have a long list.
Okay,
but
you can give me top 3 if you want.
Well, first we have to give ourselves grace. I keep hearing the reference to 911, which I think is really important, but a lot of us grew up where we had cards on our fridge with phone numbers, right, before 911, right? Most of them weren't filled out. There was like the FBI, like, we're going to report a white-collar crime. Don't know why that was on there. But, it took 20 or 30 years to really, bring 911 up and running. And so we've done a lot in a short amount of time. So first I'd say, give yourself grace. Change is hard. But I also would say that it's the stories that make a difference. As a legislator, I can introduce the most perfect bill, but if it's not the stories of the why, it's going nowhere. And so one of the things that happened during COVID is we were remote, and we had the 988 bill had 160 people sign in support. And that was just so, it was saying this is so important. And so I do think as we're engaging the community, we need to have all the voices at the table helping to shape the way, and that's what's going to get us through these things. And we can't be too hard on ourselves. We can't fix the whole system at once. I heard so many people to say, well, maybe we just start here. 988 is the catalyst. That is a step forward that is going to help us, I think, create a better system overall.
You mentioned the community. What changes, hopefully you've seen some, in the business community on mental health?
Well, it's interesting because I do talk a lot at chambers and at Rotary, and I think they're really open to these presentations. Again, I think it affects their families, it affects their employees. So I think the business community does want to be part of the answer, and I think they can be part of raising the awareness, because I do think they're connecting with a lot of people in the community who, again, there were small business owners that were so impacted by COVID,
Yep.
right? Very difficult times. I do a lot on foreclosure prevention. A lot of people lost their homes. So again, I think they were touched. They know this is an important issue, and they really could be one of our allies.
Has Washington State learned from other programs or other states?
Yes, well, one, there's a 988 Jam. If you've not listened to it, you should listen to it. It's incredible because they look at best practices all over the country. We got inspired in our state, and we took a team to Arizona who is doing incredible work. And we had a missing component in our state, which the crisis relief centers. And so Senator Dinger I worked with did a bill on that this year. We need those no-rung doors. We need those alternatives to emergency department and jails. And so it was really helpful to see Arizona. We've connected with Georgia, Colorado, where I used to live. So I feel like we're all learning from each other, which is so part of the process. We compete with Oregon, but I'm sure they're doing good stuff. But we learn from each other.
You mentioned younger generation, and you mentioned your father. We talked earlier before about how the younger generation does want to talk to people, even though they've gone through a very difficult time, but they're more open to it. Have you seen with the older population that it's a little more difficult?
It's so interesting because I think there's maybe a gap in asking for help.
Right.
And of course, I work with a lot of veterans. That's one of my priorities. And I do think the engagement with the veteran population, especially older veteran population, is going to be really important. And I did see the other day a veteran, we were doing this great event, and he gave me one of his friendship coins, and it had the old number and it had 988 on it, right? So we need their help getting that message out. And again, I think there's a lot of stigma there, and I think, hopefully we can help break that down.
When you go around and you're speaking of stories, when you're talking to veterans, depending on what statistics you look at, but I've heard there can be 22 suicides a day from the military community. How has that affected them?
It's huge. And one of the things we did with the 988 is we created a 988 emblem, and the proceeds go to veteran suicide groups. And what we found is the peer-to-peer is very effective for veterans. And there was a veteran that shared his story that he had called 988 and he'd lost his wife to cancer, he had PTSD, and he had seen something that said 988 on it. And he called and he said, the woman answered, and she had this soft, kind voice, and she told me everything I needed to hear. And she'll never know that she saved my life, but she did. And so I do think with the veterans, it's really important who the messenger is, right? So we need to make sure that we're partnering with a lot of the veteran organizations to really get that word out in a way that's meaningful to them. And it is a huge risk population, absolutely.
Is there anything that I didn't ask that you would want to say that maybe I didn't trigger?
Well, one of the things that we're doing in our state, I'm sure it's happening in other states, is we're partnering with 911. And so part of the legislation is we're co-locating some of our 988 staff at 911 centers. And I sat in one the other day, a 911 center. They have very difficult jobs. They're dispatch, they're like 120 seconds, right? And our 988 is more of a clinical intervention. And so we're hoping by co-locating some of the 988 staff that they will transfer more of the calls to 988, that they'll get more comfortable. The day I sat in, I'd say 1 out of 4 calls were mental health calls.
1 out of 4?
1 out of 4. And one was an active suicide that just needed the police to get out there. But the other 3 could have been a 988 intervention. So again, I think we're trying to figure out those partnerships that can be effective. And again, it's going to take time for people to know 988, so we do want to work with 911, and they're important players. And so the other thing we're doing is a lot of training. And I just think that's especially important. Like, Washington State has a very rural area, and our highest rate of suicide is in the agriculture community. And so we have to understand, like, rural Washington, how do we reach out to agriculture communities? And I think 988 is doing so good on LGBTQ, and we got the Spanish-speaking line. I think the more we can do to tailor 988 and the responses in the community, the better.
Right, because this affects urban, rural, and sometimes the rural community is not thought of as well.
Absolutely,
Okay.
Very important.
Well, thank you for traveling so far, and I'm sure that your story is very powerful. Please thank Tina for joining us today. I'll give it up to Sam. Thank you so much.